National Health Mission, Government of Meghalaya.
A very good evening to each and every one of us. I would like to foremost welcome everyone to this special discussion organized by the NHM, Government of Meghalaya, where experts from across the country and in our state as well, we will have a discussion on how all of us can overcome the fear in the midst of COVID-19. Ngai kublai ya baro ki pa don ringkat lang batngi bang priang subha ya pi shakane ka special program kaba da penyat da NHM Government of Meghalaya hakaba ringkat bat ki start perkhat bat ki doctors ki ba long ki bala tebet hakane ka phang nginya kren kumno ngi kum ki breu ngin la ban ngila ban yale persya ya bejing tieng berkejing seir ha ka bayadai bat uknyang COVID-19. I would like to welcome our esteemed panelist, Mr. Truman Basayomat, who is a psychologist in the District Mental Health Program East Khasi Hills. Welcome, Truman.
Thank you.
I would also like to welcome Dr. Dida Khongla, who is a consultant psychiatrist in Suncare, Shillong. Dr. Andrisia Mauyong, who is a consultant psychiatrist in Mimhans, Shillong, Laumali. And a good friend of mine, Dr. Abhinav Chichra, consultant psychiatrist from the Christian Medical College. Once again, I would like to welcome all the four esteemed members, and hopefully we will have a fruitful and meaningful discussion in the next few minutes. Kajing tiang bat kajing seir hakabaya day bat COVID-19 hakabaya day beruknyang hakabaya day bat kajing snotho kajing shitam hakabaya day bat kajing pediang jongi kipat ba ia kajing shitam jing pediang jongi kipat ba ia kajing sumar bat kajing pediang jongi kipat ba hakabaya day bat ketika penilai persya ya COVID-19 kalong ke ba ngi kabong ke ba la penthut ya kajing ya bet jang kam bat kala pen slam ya ki ba bangin yo bangin light luot ngam de khnya te ha kani ka janmet ki don ki doctors bat ki specialist ringkat bat ngi bangin ya perkhat lang kumno bangi kum ki pat ba ngila ban le hakum kani kapor. The COVID-19 pandemic has brought about a lot of fear, a lot of anxiety, and even depression among the general population with regards to the disease, acceptance of treatment, hesitation of treatment, and even vaccine hesitancy. And it has resulted in delay of the society as a whole in getting rid of this disease and return to normalcy. So we are joined by specialists from across the country, and hopefully we will have a fruitful discussion. Before we start off with the questions, even a few days ago, one small 5-month-old baby was brought to the hospital with complaints of fever and breathing difficulty. But the moment the baby was tested positive for COVID-19, the parents straightforward and outright denied the diagnosis, denied that there's a need for treatment, and took the baby home the same evening. This has resulted in the child losing his life at an early stage from a disease where treatment is possible. We understand that a lot of it is because of fear and anxiety and other issues, and we shall attempt to to answer such questions and get to the bottom of it all. So the first question is to Dr. Kongla. We have all seen that there is significant stigma associated with this pandemic. Can you enlighten us all about some important factors that led to that, looking specifically with issues concerning our state of Meghalaya?
Thank you, Dr. Meban, for the introduction and also for bringing to light about issues regarding stigma. Now, from the beginning, when the pandemic started in our state, there were a series of very unfortunate incidents that had happened and which was largely attributed to stigma. And this has led to a lot of negative labeling, marginalization, and even exclusion of people simply because they had the infection. So it is important to understand that stigma is the disapproval or it is the negative attitudes that people develop towards people with certain characteristics or diseases. Now, it went to a point where people's stigmatizing reaction was so severe that they even had negative behaviors for those that were deceased and their family members. So, this indicated that there is a strong and a very deep seated embeddedness of irrational fear and threat that the virus had brought along with it. Now, stigma is mainly caused by lack of knowledge, but more importantly, it is caused by insufficient information. And the common consequence of this is discrimination, which is an example of grave violation of any basic human right. And this, as Dr. Meban, you had said that it has led to a lot of concealment of the infection, delay of immediate treatment, and even refusal to comply with healthy behaviors, which might ultimately undermine the need of solidarity that we need during such a crisis. So there are ways how we can reduce this stigma. As much as we are responsible for stigmatizing and displaying negative behaviors towards others, we also have a role to prevent it. Mainly, number one, it is through acts of kindness, showing empathy to those who have developed the infection. Importantly, speak up against any negative stereotypes. And it is not surprising that negative stereotypes can come even from educated people. So, even though they are educated, we have to have the courage to speak up against any negative behaviors that are emancipating from them. Another important point is we should understand the disease itself, and we should understand it by checking information that is very reliable. Apart from this, it is always useful to avoid using certain negative words like labeling a person as a suspect case or patient zero or a super spreader, because these languages might have negative meaning for certain people, and this will then fuel the stigmatizing attitudes. Let us try to practice simple praise, such as saying thank you to someone for, informing others about their contact with a person who's infected, or say thank you for wearing a mask, because this can go a long way if done collectively as a society. And behaviorally, we have seen that if we praise someone for doing something good, we are more likely to do it. So these are certain points on how we can try to overcome stigma associated with the COVID infection.
Thank you, Dr. Dida. So what you are saying is that a lot of a lot of instances that happened in the beginning of the pandemic, which had led to a significant stigma. As I understand, people here still feel that when you get COVID infection, it is somehow their fault. They still believe that it is something. Some people have gone to the extent of saying that it has brought dishonor to their family. So, like you clearly said, I think it's high time that we as a society, we change our attitude towards COVID-19 patients. Thank you, Dr. Kongla, for that answer. The next question is to Dr. Maoyong. what are the reasons you feel are responsible for so much fear, anxiety, and hesitation among the general population with regards to accepting the seriousness of the disease, willingness to test, and health seeking behavior in COVID 19?
Uh, Thank you, Dr. Bevan. Yeah, from my personal experience, I feel like COVID-19 has caused a lot of handicap in our life. We have lost our freedom if to move freely, to mix freely, and some has experienced down in business, and some have lost of business, and we have been put on hold from traveling and seeing the world, and our daily activities in life has slowed down. So all these has caused anxiety among all the people. So I will include myself also to be in the general public. I feel like we all want to deny the presence of this pandemic. We want our normal life back, what we had prior to the pandemic. And yeah, and then people, when it comes to testing, majority of people, they don't want to test because they fear the procedure. And some of them, they feel like if they go to test and they are tested positive, they fear that especially for those daily laborer, those who are doing business, then they fear that they may have to isolate, their whole family will have to undergo tests, and their family will be in quarantine. So for those daily laborer, they don't want to lose their job. And for those who are doing business, they don't want loss in their business. And some of them don't want to face the stigma, just like Dida has mentioned. And some of them fear that if they are tested positive and if they have to isolate, they are scared that there'll be nobody to buy their grocery and other requirements. And for some, they may be having some physical illness. And if they go to test and if they're tested positive, their surgical procedure may be delayed. Or if it will be done also, they are scared that their family members will not be by the side because they will be kept in isolation ward, and their family members will be on quarantine. And when it comes to treatment seeking behavior, majority of the people I what I saw, when they have fever, when they have cough and sore throat, or any symptoms which is likely to be COVID, they prefer to go for over the counter medication, because if they go to a doctor, they will have to test, and if they test positive, then they fear that they may be categorized as COVID positive, and they don't want to experience the isolation, they don't want to go to quarantine because they don't want to lose a job, they don't want to experience loss in their business, and they don't want to face stigma. Yes, that's it.
Yagito ka jubab chumpi kalong ko basyay ngan ong hangni ba kat kum ka request jong ki babun ki bapet ikani program kadon ka jing kerpat ba yak e ba ngi kren hangni an penkala khasi te kadang kalong ka jing kerpat na kaleng jonga yaki specialist panelist ki bodan rengkat bat ngi lada pila kalong ba pin pila ban kren daga khasi ne pin takren daga pareng ru ba pin sobha wanchu kren lang daga khasi ba juk por ti ha ka ba ka e ka ba ikren ni Dr. Mauyong mentan kadau ba kadon shibun ka jingtieng ka jing kuslai ka jing sier ha ka ba yadai ba pin ka jing shitam bat katahi kala wanra ya ka jing sngo artatien jong kibriu ban wan chakmat ban ong ban tes ba kidon kita ka jing shitam ba bakin sha yala dia ban wat ka jing sumar bat hadu ka ba penlong yaki kepada pen sitom sisya ti kawai kadau yong i Dr. Moyong kalong ba kibrio kisngau ba lada syaong na sya diagnose na sya ong ba sya lap ba kadai ka COVID-19 ti kandon kejing sya nyau ben ha ki wei pat ki para brio imlang salam te ya katahi ke juk bi kran ni i doktor di damne ba ngi dang dei hi ha kata ka stage ba ngi dang snow ba ka ngi dang kejing snow tieng jongi ya kejing pang covid kadang dei ke bom ya hap shu pat kejing shisha te kata ka la mandai ka wei ba ngi du ya ka kam ka jam ngi du ya ka jing ka kamai ka kaji hagaju kapor balada test positif ngi sngo ba kala ban penlong yangi bangin hap ban sa marwei te katahi kedai ke ba babon balang kibriu kim dakwa satya ban ya lingba banong ban syong shipos ngi marwei klem ki brio ki ba itu jingai na ki ba et bathon ki ba hieng ba sem kalong ke ba shisha ya bon kibriu na kata daw we babon balang kim wan chakmat ban test ban wa ikijik sumat the next question is to Dr. Truman or to Mr. Truman Baseomat. Managing mental health and well-being during the COVID-19 pandemic has of late become a topic of concern. Which part of society, in your opinion, is psychologically most affected by this pandemic and why?
Thank you, Dr. Meban, for the question. And before I answer to the question that was asked to me just now, first of all, I would like to say that it was a huge privilege, and I'm deeply humbled to be here today among all of you incredible panelists who are great achievers among themselves. And I feel extremely overwhelmed to be part of this panel of discussion. And I'm sure that through this program, people will be enlightened and will be getting a lot of information concerning with this program. First of all, I think before answering to your question, I think people, first of all, they should really understand first what is this mental health. Because mental health here plays a very, very important role in every aspects of our life. And we should understand also that mental health here, it focuses on the overall well-being of an individual. So once an individual is able to take care of their mental health, that means naturally we'll see the other aspects of life, whether it's a social life or the spiritual life or any other aspects of life also. You'll see that an individual will be able to cope up with different situations in life. So which also show here that if a person is mentally fit or if a person is mentally strong, it also shows that a person can make a lot of significant contribution. They can also do a lot of, they can perform their day-to-day activities as per as their need or as per as the requirement. And in case if a person is mentally weak or is mentally disturbed, naturally you'll see that an individual will not be able to cope up even with the normal or the basic day-to-day activities like they used to do. So therefore, it is very, very important for every individual to understand what is this mental health all about and why is it very, very important, especially to take care during this time of COVID-19. And when we're talking about the parts or the parts of the society which is deeply affected, I personally feel it's definitely people belonging to the middle class or probably the people coming from with low social economic background, because they have a lot to do with the basic requirements, with the basic necessities of life. So sometimes even for these such people, what happens is that we will see that they will find it very, very difficult even to manage or even to get the to meet the basic criteria or to meet the basic needs of their everyday life. So that is one section of the people which I feel is definitely being affected. And also we should understand that this COVID-19 itself, it does not affect or it does not target only a specific community or a specific culture or something like that. It can happen to anyone, whether coming from a rich family or whether from, it does not have any differences or any differentiation between the rich and the poor. So it can happen to anyone and irrespective of different age group as well. So it's very, very important that we start taking care of this mental health. And at the same time, because once, like I said from the beginning, once a person is mentally fit, once a person knows how to handle the mental status of mind, that means naturally they will be able to cope up as they go on with the situation. And also, apart from this, we also see that especially during this time, it also has a lot of impact to do with the educational system as well, especially with the online classes and everything, because we know that every parent these days, they would definitely love to provide a good knowledge or a good education system towards their children. But sometimes certain family members, especially if they come up from a low economic background, they find it very, very hard to even get the basic necessity, to even get a smartphone, or even to just get a proper network also to educate their children. So I feel these are some of the parts of the society which is highly affected by this COVID-19 situation.
Kublai shibun ba truman sungtanat ba pila yathu ba pila ongshai ba ka jingkot jingkhia ka jingmut jingpurkhat ka dei ek ba kongsan ba khamtam ha ka ba yadai bat kini ki por ki ba ka don satang ka jing ha baro kiliang nga ba truman ru ila yathu ba ka jingpang COVID-19 ka kta solensar mot kamap iki brio ki beduk kamat iki brio ki brio spa compare lada pidai de na kanu ka judgement rio de na kanu nyam ka kta solensar ndrei ki ba kham sha kta khambon ki de hi ki brio ki ba khamduna ka yok kot namar haba khamduna ka yok kot haba kaduna sakabam kadi kaduna saka ha ka ba kila ban penbiang ki jingdon kam ki ba man kasngi ka jingkta e ga jingmut jingpurkhat ha kum kini ki breu ka khamjor shisha te khublei ba truman ya kata ga jubab jongpi ngan kli pi sakawai ka jingkli what are some of the important psychological issues faced by the people in general during this pandemic ki kita ki jingpang ki jingkta e ka jingmut jingpurkhat ka ba ki breu hi ki ia kendo bat ki shem ha kaba habangi ya lemba kenika COVID-19 pandemic.
Habangi ya pai bat shagini ki psychological issues hakabayate bat kenika COVID-19 lane bat kenika klam khat khandai ngioi baningkong hi hakabayate bat kani ngioi ba kenika COVID-19 hi kaningkong ka wan shwa kata ka jintin, where we call it fear. And I personally feel also that it actually stems out from fear. Because once a person experiences fear, what happens is that a person will not be able to control certain situations in their life, and so once they cannot really control with this fear, so naturally it leads or it gives the direction to different other psychological issues also which a person can go through, such as anxiety, such as stress, such as depression, or sometimes it can even lead to suicidal thought or to suicidal attempt as well. So I feel these are some of the important psychological issues that we happen to see during this COVID-19 pandemic situation. And apart from these psychological issues which I've just mentioned just now, I also feel, in my opinion, that today, apart from these, I feel that adjustment difficulty, or in other words, adjustment disorder, is also one of the major psychological issues that a person is going through. Why? It's because because they will find it very, very hard to adjust or to adapt themselves with the current situation. Let us all be aware, and we are all aware of the fact that at the present situation, we are all living in this new normal life where everyone is talking about. So therefore, for certain people, they find it really, really hard and really, really difficult to adapt or to adjust themselves with this current situation. And then apart from that, we also see that sometimes there are certain individuals, there are certain people also who finds it very, very hard and very, very difficult also in terms of adjusting or to comply with the restriction. As well, we see that there's a lot of restriction that has been put across, to protect. It's for our safety. It's for purely for our safety. But sometimes, certain people, because they cannot really adjust, to they feel that there's that the freedom somewhere is being taken away from them. So sometimes they find it really, really hard to even combat themselves with these adjustment difficulties or with the restriction that is being put across the state or across the country as a whole. So I feel that these are some of the important psychological issues where an individual is experiencing during this COVID-19 situation.
Ba cuman pila ban kren lingkot da kasi ek wapi laong mentan ngatrai da yo snow na sintur jo pi kan kam kibri kan kam snow tho shy.
Hakabaya day, but kani ka psychological issues, kini issues ki day, but karukam perkhat perdaing jongi ki brio, ningkong kumang ong yapi ngatrai kan sedang shona ka jingting. Tilada ki brio kimla bante lakam yala ka jingting. Dia suki kawan rapat kaya lampat sya kiwe pat ki psychological issues bakta hakabaya day bat karukam perkhat perdaing kata kum ka anxiety ka bangi khot ka jing khuslai lani ka jing long khuslai lani ka jing ngau long khuslai hakabaya day bat ka jing long jing ban jo ka situation jo ka perthei nang ta de teng kawan ra ru ya kani ka jing ban khia hakabangi ong ka tien pharing stress namar bale ayu bakimla bakin adjust lani bakin cope up kani ka situation tinalo jo kata teng kawan ra ru ya kani ka jing pang ka bangi khot ka depression ka jing pang ka jing smosi ka jing diau bat kumju ru teng lana ki brio kilong ki batlot hadu kata hawaya dei bakani ka jing berkhat teng kala ban yalam ya kiru hadu bakan poi uput baki haban shim no ela ka jong ka jing im lani bakim kimban si bakin shim no ban dekhat no ela ka jong ka jing im ru ti nalo jo kini ru sngo ba kadi ka adjustment disorder kamot ka rukom ban ngan ong no hatin khasi adjustment disorder kamot hakabakin pinyasmo eladi bat ka jinglong jinman jong ka pertheiru ngasmo baki ki don kata ka jingsmo jinja hakabaya dei bakani ka bentaru namar ba bonap nang ki brio kim patmat ya kani ka new normal life ka ba menta ba shisnem shiteng eng lai paro khoi na preng jong ing im hakani ka jingiem ka badon with so much of ki kindon mo baka ek bangi day banle ek bangi day banle dengan snow ba teng ki brio ru kila ban yo kila ban ma ru ya kum kini ki jai issues hakabaya day bakani ka klam COVID-19
blay ba cuman ni kitu ki kentien ki basyai bat ngangai ba baro ki snow tho ba ha ba ngitieng kan kata bon ki e ya ka jengmot jing khat jongi kalaban penlong yangi bangin khuslai kalaban penlong yangi bangin snow si adu bangin numla syo wat tang ban ya dei bat bangin im ha ka im lang sa lang kum bakalong menta ti kublai shibon sa shisien ba cuman ngan bo sakani ka jingkli ya I Dr. Mau Yong, how can you help others cope with the situation of fear, loneliness, depression, especially when tested positive and when on self-isolation? Kaya ka bangila banle, kum ki breo, kum ki paramarjan, kum ki parlom, haba ngiyoi ba habang isyem ba ngi ladiehi ne ki parlok ki paramarjan jongi kiyo e kita gi jing kum kajing tien kajing sngo kenja kajing sngo khia kajing sngo si bat hadu kata upot ba ki sngo ba kajing kut lat kalong hadu kata ba ki sngo ba kam mentoi shu wat ban im ni perthairu Dr. Moya
when a person is tested positive and he has to isolate alone, it is very natural for a person to develop some fear, loneliness, and depression. But I would advise to the public that don't think, no, they fear that, some of them, they fear that they may have severe symptoms. Some of them fear that they may die. And some of them fear that they may develop complications. But my advice to the public is don't think unnecessary for the thing you have not developed, especially if you are asymptomatic. And if you cannot stop the thinking, then you just say to yourself, stop thinking. If you cannot stop those thinking, then you have to follow the coping strategies. There are a long list of coping strategies, but I will tell you only some because of the constraint of times. you have, if you are alone, isolating alone in a room, you have to keep yourself connected. Do a video call with your family member who are present in the other room, or with your friends, with your relative. Then eat properly, sleep properly, exercise, listen to music, dance, and do something useful. You can write poems or poetry, you can draw something, and you can watch your favorite movie. And you can also practice relaxation therapy. This relaxation therapy is like you have to relax all the muscles of your body, starting from the small muscle to the big muscle. For example, I will show you here, like when you do the relaxation therapy, like you have to make a face, count 1 to 20 and relax. Then you flex upward your hands and count 1 to 20 and relax. Flex the elbow, count 1 to 20 and relax. So similarly, you can do for the left hand, and then you can do for the right leg, left leg, so that you distract yourself from fear, from loneliness, and from depression. And if you are symptomatic, you call the healthcare provider, get the medicine, continue the medication so that you'll be well. Okay, hakin kasi lang ba? About dulu beliau nak test positif at uhapan isolate marway. Kalau naturally ya baru beri habat uhapan siyang marway and long positive pangin tien. Pangin perkat oh let's see yung ikam shitom jur landi yung iyap landi yo develop the complications. Then Ray wapa benong sige ba im day ban perkat unnecessary ya kaega pu samplat tempat develop, especially at the dan symptoms di tang balada mla ban control ya kita kajing tie ya kita kajing perkat filamen oil di stop thinking dia hagju ke poru filamen follow kita ki coping strategies ibun bagi coping strategies rai yang ong tak dia ka bani kong kedai pihak ban le video call bagi bahayeng la jong pada chekiwe bagi kamera lani filam video call bagi parlok jong phi bagi iet ne bagi bahayeng sam dan pamba tiap ha exercise skap jing rai shat le kanu ka ban pen klat ya fi na ka jing so marway fila ban po jing rai ne fila ban po story ne fila ban draw something ne fila ban pet film kiba pi jusmo tanat ban pet machua te fila aru ban practice kata relaxation exercise kembangan patai mentan apa fila ban relax yaki muscle yaki domat jong pi adu ki baret hadu ki bahe pisdang naga ti kemek ti umto pinyo hadu arpo dan relax filem tu pinyo do arpo relax file pemdi pinyo do arpo relax. Then we continue ya ti kadiang continue ki kejat kadiang ka kejat kamon pero kenapa bila aban relax ialah dia. Then bila aban practice kata ka imagery bila aban perkadial dia pafidon hangno lani ha beach ka bolong kerja pat badan ka air pengar perkadial dia pidon hangta but ring mensiam jalan. Take a deep breathing, exhale. Take a deep breathing, exhale. Lagi ni, bila pun perkat yang dia pidon hakadu kanu kekir, pidon dikisentir ke kebun, padon kawahadan. Perkat yang dia pidon hangta kaprep ikemat, but ring mensiam jalan. Ring mensiam penihar mensiam, ring mensiam penihar mensiam. Hakata kerukom, bila abad penihar yang dia nak kiniki, jingting di so marwe begitu. Tanpa habang when we talk about depression, suppose a person is tested positive and is about to develop depression for the first time. If you feel like you're having some symptoms of depression, then you should never keep yourself aloof. You should connect yourself with the with family members, with friends and cousins, and follow the coping strategy, relaxation exercise, and imagery. And the advice to the family members is like, don't ever leave a person with depression when a person with depression and isolating alone. Don't ever leave this person unconnected. You should always do a video call with this person so that you can, if there is any symptoms of depression, it will get noticed at the earliest, and so that you will be able to bring this patient to a psychiatrist and get treatment at the earliest. So, activity, ang hangyakan niya kanina jing jing sosi, the siyong no lada ubriw uyo COVID positive and ula ban yo depression hakin ka banintong. The lada ulu ubriw ko bodon kita symptoms of depression. Today ban siyong marway long siyong marway hap isolate marway tang umday ban bu yel di hak ta kom bandum call chu ino bandum kren chu ino ray uday ban le video call bagi tam ki bahayeng ki bahajan tam ni pa ni men para follow ki coping strategies pembangalan patay mentan relaxation exercise. Ye nagalian ki bahayeng ru penjuday ban ia uni ubriu ba le si udang sedang yo depression lani ubriu ubaladon depression yo COVID positive hap isolate marway penjuday ban ia uni dem da communicate kam da keren kam da ia contact hab ban le ka video call ba kanang ba in hab I moral support ya ban reassure you and then hagajo ko pot kanang ba pinla ban yo ila don kinu ki symptoms ru nang pila ban wanyalam no yo shiki psychiatrist ban yo kajing sumar ka employ nang ba lada kumno kila ban don kijing kwa ban suicide ru ngila ban ya dano employ.
Kublai Shibun, Dr. Mauyong gitu gijing pensyai, kiba syai ha waya day, but kumno ban yale persyai gini gijing sngoper jo gijing bot jing perkat hawa ya day, but kibriu kibala sya test positive. The kendiat ru kan kerpat ya iba cuman basayomoj hawa menepi la kren ya ka jing sngo tien, jing sngo kuslai, jing sngo marway, jing sngo bomla ban kup jong kibriu jong kipat bapat mendadai le sia tang ya ki bala test positif dai ki pajba hi salensa ngaso pin lada pidani ai ban kren kendiat kensot nomor kapor kalaya kendiat kensot ya ke jing kentu ke dai jing a jing mot napi ya ki pajba pat hakum kini ki pot lengkot ba cuma
hakabaya day but ka message lani ya ka ekalat linti ka ba ki brio ki kila ba kin te la kam ya ladi hakabaya day ba ka jinong jinman jong ka pat kani ka COVID-19 situation ngasno ka baning kong hi kum ki brio ki don kam bakin engage yelade into different into various activities apart from their regular activities mokin haban pelun chi shai ka por jong ki habia te ba kam ka jam ka ba ki don kam bania trei he bania tu ka kam ka ba ki ju trei man hasmi tinalor jong ka taru ngatrai ka we ka ba kong santam ha na du ne ka belak ni Dr. Khongla ha ka bastam jon ka program ba kum ki brio ki don kam ha shisha bakin kiar ha ka ba te bat kani ka stigmatization namar ba teng ki brio ki tam shudon kinu ki ka jing pam kum ki ka jing shit lane ki dadon ka jing jer ho lane ki we teng ki brio kila pek khamat lupa ya ki ha ka rukom ka pam itna te teng ka tu ka jing le chong ki brio teng ka wan ra no itu ki brio bakin numtur sakhrang lane bakin numtur sakhmat bakin wat ya takalat kilenti ka be dei bakani ka benta tinalor chong ka taru ngasmo ba apart from stigmatization, it is very, very important to support, to motivate, and to encourage each other. Because that is the only simplest way where every individual can do it. And it's not difficult. You don't have to wait for a health professional, or you don't have to wait for a psychiatrist or for any other doctor or a psychologist to teach or to do something like that. You know, it's just a matter of how you support the individual concerned, and also by encouraging and at the same time motivating such individual. I think that is also the simplest way to be able to cope up with this situation. And then apart from that, it is also very, very important to stay active, you know, but to stay active throughout the the situation, that is by eating healthy food, by practicing, by doing regular exercise and all. And in case if a person is feeling very, very stressful or very, very stressed out, as Dr. Kongla has already show a little bit of that relaxation technique. I'm sure that relaxation techniques also could be one of the major factor which can contribute, an individual in order to be able to cope up with the situation. So, and also we, as individual, it is also very, very important that we start developing these new coping skills, or rather we can say defense mechanism skill. It's very, very easy bagi chia keren mo hakabayade ba kumdu banyarap daladia kalong ke basut bangin chia keren den rementa kungki brio limba gani ka program gidon kam ban smooth ho shai bangi don kam ru menta ban prang persang ya ke bangi thmu lani ke bangi keren namar bon teng teng ya ke bangi sios ngo lani ke bangi pet lani ke bangi puli ka syukut be tang hang tu te hajaka bakan syukut be hang tu ngidon kam ru tes lani kumdu bagi stang ban persang ban bot ya ke bagi puli ya ke bati penya namar lingba kata ka jingle lani kata ka jing persang jong ini kan wan rahi ya kata ka kan pelat yang ni kibriu na kata ka jingtieng bat kumjuru na kita kijing huslai hakabe dei bakan ka kelam COVID-19.
Kublai shibun ba truman kumbaki laong baro armud ki experts mentan ba kalat bangin la ban yele persya akaba ngin yada yala ka jong ka jumut jumkat kawai kadai na ladie hi bangin penbernya yala di bangin le eki ban pen klet ya kata ka jing snow kuslai ka jing snow tieng akaba dai ka jing pang hakajuk kaporu kalong ka bakongsan baki bahayeng bahasam ki parlok parajor ki marjan para mapa kin kiru kin don kabenta ban keren ban yarap ban numpun sngau kenja ban numpun sngau si ban numpun sngau tieng ya ki para brio ki ba ngat akani ka jistam kublai shibon baro armut. This next question will be directed to our friend from CMC Vellore. You have heard from the other speakers regarding the ground reality of things here, regarding so much stigma which is associated with the disease, regarding so much hesitancy in terms of health-seeking behavior, in terms of acceptance of the COVID-19 vaccine. There's a lot of anxiety, there's a lot of fear, a lot of depression among patients and the masses in general. We would like to ask you, Doctor, if the situation is any different in Vellore where you are practicing.
Thanks for that question, Meban. Well, actually, practicing in CMC, sometimes you think you're in a bit of a bubble. So I can tell you about what's happening in CMC, and I think across Tamil Nadu. From what I've gathered, though people are quite anxious about the vaccine here as well, the anxieties about testing and accepting the diagnosis perhaps are a little lesser over here. What's I think same everywhere is the psychological reactions to just having your whole life turned upside down, which is basically what's happened in the pandemic, and constantly being afraid for your health, not something people are used to. So those psychological reactions we're seeing are pretty similar, but I think just in those two facts, it's a little bit different.
Okay. Thank you, Abhinav. Kumbai ong Abhinav nganchu kusang ban kelakasi. Kibrio siya kejela keba iitrei haka hospital keba iitrei ru kidon hi kejing sngo artetien haba yadai bat ban shimne bom shim ya ka COVID vaccine. Drei ha keba yadai hi bat kejing sngo tho ya kejing pang bat kejing kwa jong kibrio ban yo ya kejing sumar ha kiwei ki jela jong kari te om da yo I hado kumbalong hangi te ban ong ba ngi kin shong hayen wat shusha ya kejing shitong ban ya ba letche ban letche hospital ban yo ya kejing shitong kata ka de ek ba ni kim yo I shekiwe ki jela. I would like to ask Abhinav again regarding what do you think is the reason why people this side are so hesitant Or you can even put it another way: what makes people in the state that you're practicing more accepting towards the nature of the disease and health-seeking behavior?
Quite a complex question. People deal with new things the way they've dealt with other new things in their life. That's what I think. So the pandemic is something new. You have to look back at that culture and see how has that culture dealt with very new things, startlingly new things earlier. You also have to see what is the relationship that the people of this community have with the healthcare system already. So again, I'll say that CMC might be a bit of a bubble because we're working in an area where this institution has been fostering trust locally for a long time. That may not be the case across much of the country. So if the government is generally perceived as not reliable, then it's a little difficult for people to rely on them suddenly in this crisis. So maybe that is the answer to why there's some differences in these two communities. But I'm myself am not sure. Maybe the rest of the panel can also pitch into some to help me answer that.
Thank you, Dr. Abhinav. Cái bài ông i Dr. haba kli balay kaya pair bagi judgment rio hakiwe ki jela kilong ki bakloy ban pediang ba kadai ki jing stom ko badon kam ki jing sumar te I ong daga jing snow thu ba kum ki brio hi ngi long ki ba long kadong ka jinglong jong ki brio hi ban priang ki bathamai khamtam habaya dei bat ki jat ban rio ba pher don ki jat ban rio ba lada wan ki bathamai ki long ki ba kloy ban priang rei ki don ki jat ban rio pat haba wan ki bathamai ka ba pun kalai ka jing im jong ki sngo ba ka dei ka ba dei shisha ban chi priang marmar te ka dei ka nga sngo hi la de ba kaba iong ni Dr. Abhinav kadai kaba yaha but ke imlang salang ki patba jungi shani ba ngi kum kajat pen rio naduk menshwa hi habang yo yak ek ka pasmai ngi long ki brio ki ba artaten ngi dap be ka jing artaten ban ong ba wat lada kawan na ka sorkar wat lada kawan na ki doctors wat lada ki wan na ki brio ki ba hakiwe ki kep ngin jendala shania eki hendrai lada dei ek thamai ni kham chenjar man shania te kalong ka ju hi ka bangi yo I ha ka ba dei bat ka adhar lesi ha kisnem ki ba khamrem ha ba dei bat ka epic to ka epic card on shandur bangin la ban yo ban thep vote te ka jing pen na ka liang ki brio jongi shane ka don lupa te dei na ka ta ka daw hi ba ngi ha ba dei COVID-19 ru ngi sa sham ki ki jing te mentang la poi shakawai pat benta jong jing kren ki don arngot ki live callers ngan khot iway hadin iway be in kren but ngin saya jubab ni kita ki jingkeli jongki yeah. Hello, we will now be taking the callers. Mr. Naresh, is it? Welcome, Mr.
Yes,
Naresh. Please ask your question.
Thank you, Dr. Meban. My question is specifically to do with the children. There are 3 children in my house. And see, this thing, as you have been all sharing, it has disrupted our lives, but also our children's lives. There is a lot of added stress and anxiety. And my question really is, what advice as a panel of doctors will you have for the parents for us to be able to deal with our children right now? Like for instance, we are trying to see, should we stress so much on their studies, knowing that the online classes are not the same as the actual classes when they attend school? So I've been telling my wife not to stress them so much as to break their spirit. Also, they are not able to meet their friends and the physical activities that they regularly do. So what kind of advice would you have? It could span, over food habits, or having some kind of a routine for every day. And what are some of the effects do you expect that the kids will inadvertently have when they return to school? And will you please work on some guidelines for the teachers as well, so that they teach them, they receive them back to school whenever it is, with some of those guidelines followed, so that we don't break the spirit of our kids?
Thank you so much, Mr. Naresh, for that question. Indeed, COVID-19 is affecting children in a great way. I would request Dr. Maoyong and maybe after that Dr. Chichra to shed some light on this topic as to what should parents and caregivers do to alleviate such issues. Dr. Maoyong.
Yeah. uh, what I feel as an advice to the parent is, if we think of the past where the school start at 9 a.m. and for the kids and ends at around 2 p.m. So that time they had the in-person learning from the teachers during that timing. But now they have to attend these online classes, which I don't think is very regular. It is there sometimes. Only international schools are very regular with these online classes. Other schools are not so regular. What I know. So yes, as parents, we have to do a routine like it was before, and starting from eating time to reading to attending classes. We can ask the children to attend classes, like, because we have to avoid too much of screening time also. So what I say, maybe uh, maximum of like 30 minutes in one section, and then with a gap, let's say max to max around 2 hours in a day, but in interrupted ways, not continuously 2 hours. Then you start the day for the children from like getting up, brush, and like doing some playing times, and then attend the online class. Then spend time. The parents should spend time with children. Don't spend so much time with your gadgets. And then sit together, chat together, exercise. I mean, like, you have to divide the times like it was before. Don't stress too much only on the online classes. Like, do everything as if it was the time before the COVID. And yeah, we stress on the daily routine, like brush, take breakfast, then play, then attend few sessions of the online classes, then spend time with the parents. I mean, the children should spend time with the parents. And yeah, I think I cannot say much, but I think balanced life should be there. They cannot play outside, so they should play with the children, with the parent also. Encourage them to play. I mean, like, parents should play together with the children, spend time, give them time, and yeah, don't leave them alone. They should feel love, and they should feel that their parents are there for them.
Uh, Thank you, Dr. Maoyong. Dr. Abhinav, would you like to add something to that as well?
I think that was an excellent question, and I think a question on many people's minds. What age are your kids? Because the answer sort of depends on it.
I have one waiting for his 10th standard result. There is one in class 9 and one in 8. But I'm really not just asking for my kids. I also know it's happening to so many people here. The parents themselves are trying to see their incomes are disrupted as well. So I am concerned about the mental wellness of the parents as well. But that's a huge topic. I thought at least if we have some guidelines in terms of how to help the kids, and some guidelines for what would you advise the teachers when they receive the kids back to school? Something about that will be very helpful.
So in general, I'd say that children take their cues for how to deal with things, especially new things, from their parents and the adults around them. More true for children, say less than 10 years, and slightly less true as children start going into adolescence. So the first thing you can do definitely for kids of all ages, what's your attitude towards this pandemic? Are you panicking about this pandemic? Your kids are likely to pick up. So that's number one. Number two, and I think you mentioned this yourself, I think this pandemic has proven that we're all creatures of habit. The greatest distress caused actually because of the lockdown was that our regular routines were disrupted to a great extent. So building up a new routine is actually the task for people. So around this life where you're trying to be careful about this infection, what are the new routines you can build up? Things like screen time, I think it's practically impossible to enforce the right recommendations of screen time now that everything is on the screen. So one thing to remember is that those recommendations for screen time were often made for shows, TV shows where you're not interacting with anyone. So they may not exactly hold true for school. Yeah. So my two recommendations would be this: uh, the way you react to the pandemic is probably going to be a model for your children, and it's important for them to have a regular routine again, a pandemic-friendly routine. And I'd say the same thing for teachers. It's, especially when it comes to older kids, you have to first check what's going on in their head. Because they're not just going to buy everything you say. So what do they think about the pandemic? What are their worries? I would, if I had to deal with, say, 50 kids who were coming back to school, I'd start with that. How was your experience? What are you guys afraid of? Is coming back to school like a good thing for you, or are you terrified of it? Just address the reality of it rather than pretending everything is normal. Kids pick up on that very fast. Yeah, that's all my side.
Thank you so much, Dr.
Doc,
Abhinav. Thank you.
Let
Thank
me
you.
come in. Yes, Dr. Meva.
Yeah.
No, I want to say when it comes to guidelines, I think we cannot make it overnight. For guidelines, we have to sit with some group of experts. It will take a week or it may take some time to really frame the guidelines. You cannot just tell just now. We have to sit
Yeah.
and like really frame together.
Sure.
Mm.
I hope
Dr. Mevan, if I may
you, Dr.
ask
Mr. Naresh.
just one more question.
Yeah.
Thank you. That was very helpful, Dr. Abhinav and Dr. Ante. The kids ask a lot of questions about the vaccines, and we are not equipped at all to, know what is coming, or is there something for them that's coming, or is it even advisable? Any light you can shed on that? Just a short question. Thank you for accommodating me.
This is your
I think that question I will try to address. As per current knowledge, we know that certain things are in the pipeline for children as well. When will they be considered safe enough to be rolled out to the general public? I think only time will tell. But we have come up with a novel vaccine in a period of a few months, so I don't think a vaccine for children is also too far away. And when the time comes when we've seen the studies, the effectiveness, side effects, I think experts at that point in time will be able to provide a better knowledge regarding what is coming. Thank you again, Mr. Naresh. Thank you, Dr. Abhinav and Dr. Mauyong. Ngasukwa ban pentelah hasih hindiat yang ba ikli ba Naresh ikli yang ba kikon long kikna jongi kiru ki syam jing'e ban penkelai ala kejong jing'em ha kebayadai bat kani ke kelam COVID-19 ki hapan syong hayeng ke school kalong lengba ki online classes lengba ki computer ki nong hikai ki kren na jengai ke jing hikai kamdai markhamat kum bajulong te kalong ke ek ba e shikat dai ki te katkum ba ong ki doctors mentan ki ong ba ki khna khamtam ha ka boye dai jingmut jing perkhat jong ki dai kat nang rit ki khna le ka ta le ka nang dei ka bashisha kalong ba ki pet thu bet ber ki bot dien ke ei ka ba ki kme ki kpa ki men ki mama ki na ki le ka jing tieng jong ki ka hiar pateng ha ki khlum ru ka jing sngo jong ki ha ka bu dei ber ni ka knyang jing pang ka ni ru ka hiar shi ki khlum ka jing mo jing per khat jong ki te ka long ba ni don ki dong ba ngi ki dong ba ngi dong kam ban long kum ki nuksa ki bo bhai ki khlum bangin ong ba ngim dei ban pen i ki ba ka dei shi ei ka bangin shu tieng khlem nong de ka ta ka dei ei ka baning kong bar ka ba ar haba kala ka rukom im jongi ki rang ba ru bat kala ka rukom im jong ki khna ru ngi hab wan hikai ki kumno ban pen bet ye kata kumno ba kin sngo ba hakum kani ka por ka long ka ka babyang lada ngi shong school lengba ka computer lengba ka phone but ka ba but kumno bangin le ba anda kala bet byang ka perthai kumno bangin pen i ki khna ba ka dei ka ba khambha shu ban le byang school te kini ki ba ngi don kam ban snu tho ban shukran kulum not e bor khat ka long ba ngi dei ban long ki nuksa ki ba bha ya ki kulum ki ba kin bot ya ki ba ya ki bangi ngi snow ki bangi ngi perkhat ki ngi le we are having in the comment section a direct question to Dr. Abhinav. It says, how can we ensure continued psychiatric care for patients with pre-existing mental health disorders during the pandemic?
So what we've been doing in our institute is we've been leaning into video consults quite a bit, which was not services we were offering pre-pandemic. So we've been trying that. And I think that is what mostly is happening around the country, where people are finding it difficult to go in person. I think telepsychiatry and video consults is really stepping up. There are lots of online platforms to do that. Yeah.
Kumbaong mai bahaba yadai batka jung sumar jung ki brio ki ba don ke jingpang aga jing mo jing kat ki ba don lupa ani kapor hi hap ban le hi kumbale ki ki nongpang mut ladang in la hi ban ya kendo markmat mut role jong ka tele psychiatry mo ki ong kata kade ki kongsan. Thank you, Dr. Abhinav. Going back to the discussion, I would like to request Dr. Dida to answer the next two questions. In the new age of social media and digital information overload, do you feel that a lot of this fear and panic is a direct result of it, and how can one deal with the problem? Ha ka duk trong social media, but ki kubor ki bamla shu watang banyoru hatu ki sngow ba kani kal penlong yangi mangin tieng mangin kuslai but kumno ki brio kin yele ban lat naka jing penting jong kini ki bawan bok.
Okay. So, nanduk ba sedang ka pandemic ke internet kala era bahaya ni ngabun kiliang wat na ki school ki classes wat ki kom the jungi te kaya bahaya ni tang bahaka jo ka por ka don kini negative consequences ru ki bun ki breu ki long ki malin baha ban switch on ba ka phone but ban pet ki websites but ki social media forwards ki ba tho shapang physical health batai ya kini ki health ka ba kta perkhat perdan ru mo so that means even in spite that the internet is helping us a lot there is a consequences where there are a group of people who keep repeatedly searching for mental and physical health related question and information without verifying the source of the content. They ki websites ba ki what ikini ki jingtem ki bon na ki kimde ki belong reliable. Kane kadai ke ha kane karukampan ki yo ki jing ki they get the information that are incorrect. Kani ka penlongi ki brio ban pen ki smo siir ki smo shapting Namar ba kumbang ong ki information ba ki yo kim dai ki balong tikna. They can create a cycle more. So when people are insecure about the information that they get and they're insecure about the illness, they start to compulsively check again and again for the information. And then this creates again the anxiety and the distress, creating the same cycle of again going back to your phone and looking at these messages. Information overload kamot ba nila your access than ki information na ke internet hado banging nim la ban pediang kano kadai kebab dai kano kebam dai te kani kadai ke ka side effect jong ka ni ka khlam COVID-19 ka WHO ru kala kren na ka basai kala ong ba hoi ni dai ban yele persya na kani ka khlam COVID-19 tang bangi ru ni dai ban yele persya na kani kabaki khot ka infodemic kata kamut ba nilaya bon than ki jing tip na ki internet te kane kala pen ling a yingi ki briuru. So we have to fight the infodemic as much as we fight the COVID-19 pandemic. Tamba ki don ki lar kilenti kumno bangin pen dunai kane ki jing ling a yungi na kini ki excessive forwarded messages lane ki false information ki circulate media mo kabanang kong ni day ban tip na kinu ki websites ni nuad ga ya ki jingtip ni day ban wad ki jingtip bonsin na ki websites ba penmi daga sarkar lani da ki batho de ki medical professionals lani de ki organizations kum ka WHO lani ka UNICEF. So we should be smart on how and where we look for our information from. Look from trusted websites, those that have reliable, high quality, balanced information, mostly government run websites and those written by medical professionals and those that are being published by organizations such as World Health Organization or UNICEF. Sakaway, kumba ongi Dr. Andrea ba ni day ban limit ka screen time. Ni day ban bo kapor namar ba ka don kapor ka aka ni tip ni kata. Te ni day ban limit ya ka timing ha ka ba ni pet ya ki media, ki social media, ki internet. They create a routine. You make a routine that from this time to this time I will access news from this source. And from this time to this time, I will connect with my friends. Te kini steps bangila ban penduna ya kini ka jingling from this information overload.
Boleh shibone Dr. Khongla ya kata ka jing pensyai aku bayi dai berka kumno ba kibreo kin shim ya ka ek babhana ka social media ba ka jo ka poru mdai ban ai lat ba kanda bon palat kapun klumar ya ka jing khat jing ku boleh shibone. The next question I would like to I'm getting one from Mebada Lingdor. I'd like to direct this to Dr. Abhinav. How to create a COVID child friendly environment. Many children are facing fear and anxiety. Can we think of maybe pictures or videos that can leave a positive impact in the minds of children?
I'm personally not aware of these resources, but I think if you look for them, probably the CDC, Center of Disease Control Atlanta, has some videos for children. They usually come up with these kind of resources.
Okay,
What you can do about this is sit down and have a talk with them in which you acknowledge you're also afraid. I'm also feeling a little afraid. I'm also feeling a little anxious. Are you? Then talk about how are you dealing with your fear and anxiety and get that out of the child. I think even what Dr. Daida was speaking, those are the essentials of managing something that's new. For children, you decide your model first, work on that, and then have a discussion with them about it. When they see you doing this, when they see you controlling your anxiety properly, that is the best model for children. And come up with a daily routine that you think they'd be able to follow for, say, the next year or the next 1.5 years. Something long term is what I'm saying. So if the current routine is leaving them bored and irritable, then it needs some tinkering. Some things need to be added or subtracted over there. That's what I would say.
Yeah. Thank you, Dr. Abhinav. Apa ya dai bat jikli be pa ikong me bada lengdo hatu ngila ban le ek ban pen sngan ki khlong ke ban yin pen per ya kar kom im chung ki khlong kin kham sngan ya ni ko por ke jubab ko ba yo kalong ba ki don ki videos ki don ki dur ki bangila ban page na ka CDC website hado unta ha ko ba dai bat ke ba shna ha rila jong yam ta kam padon kum ongi Dr. Mawyong ngit kin sedang don kin nang pen kre kita gi rek ba kham kong san kan long ba lada ngi yo ba ki klong jongi ki sngo ba ki don ki jing sngo ear ki jing sngo tieng ngi don kam ban ya kren shai bat ki pan ong pet ke ta ko pun ear pi ngiru ngi sngo ear ke ta ko pi sngo pi rek de ke ne ko bangi ngi le khnang bangin lat na ta ngi le ke ta kum no ngi pen per ke kom im te si sien ba ngi ki rang ba ngi la ban sngo thu shai ke bangi ngi le ya la de ha bangi sngo ear ha bangi sngo tieng da ko bangi ya kren da ko bangi ya ngi le ki ban pen klet ni ke jing shitam kata he kan yara ki khulum jogi bara. Thank you, Dr. Abhinav. The next question also I'd like to direct it to you. How should one deal with the death of a loved one in the COVID scenario? How can one console friends and family who experience such unimaginable life events? Ngan kali sa kuwe jingkli Dr. Abhinav, kumno nginle aba ngidu no yailai jong iba bathon ha ka jingpang COVID. But let's say kumno lada kam jayangi ka jayaki parlok para jok bhayeng bhasem ke kamram jongi ke bangi dai ban le khnang ban la ban puntengen ye kita kipa ya leng ba kum kita kum gini ki jing Dr. Abhinav.
Yeah. So I think where this answer needs to start is by understanding that grief is a pretty individual process. So people deal with grief in ways that they've dealt with difficult things in their life throughout their life. It will be influenced by that. So the range of what could be considered normal grief is pretty wide. So I would say that the first thing that people who are concerned about people in their life or themselves who've gone through grief is to know what would a doctor consider pathological grief? What would we consider a grief that is not normal? So anything that is causing very objective problems in your health, you've lost a lot of weight, you've not been able to sleep for several weeks now, you are unable to carry on just day-to-day activities of life, day-to-day living that we all need to do, would be the common indicators that things are heading into troubled territory. If the initial reaction of grief continues for more than a year, though the cutoff is 6 months, but I'd say more than a year, again, you need to be a little worried. And of course, if you see some signs of some serious mental illness, talking to yourself, having irrational fears, there again, you need to be worried. Now, if you don't have any of those red flags, the way that this person is going to be going through this process is going to be individual. You probably should not enforce ways that they deal with grief. Let them do it on their own. As long as they know there's support available, and as long as people are watching for this grief heading into complicated territory. So if that happens, that's when you start intervening. That's when you start asking, hey, how have you been dealing with grief? What have you been doing? Have you been talking to someone? Do you need some help? Are you thinking about hurting yourself? At that point, you need to intervene. Till then, I would say support and watch is what works for most people.
Thank you, Dr. Abhinav. Haba yadai berkatu kecing keli kemana keli mentan doktor ila keren syah ba ni kibreu ba ngiya ling ba kijing sngosi ba kijing ngidon lala kijong ki rukom bangila bangidon ka man ya ling ba shwa bangin yo kijing pun khia agam sip don kibreu kiba yam don kibreu kiba kwa bandon marwei te kabadon kam kalong iki bahayeng bahasem kadai ban ai mensiem bandon rengkat bat kita kibaya lengba kita kijing ba lada Kim don hi kano kajing yo I ni dangim yo I hi ba kita ki ba snow si ki le ki ba kalong kajing tiang kalong alarm sign bangila ban om ke ngim don kam banda ong ban penbor yo ki ba kun le yak e ba ngingi snow day ban le tela da ki yam kam day ka kamram jungi ka ban ong wat yam sure lada ki spa ban shong marway si por kam day ka kamram jong ki ba et ba pathan ban ong em kim day ban shong marway ba pi day ban wan shong ni kemudian kam kalong tang ban snow thu ba don ba pet ya kita ki parlok kita ki bahaye don ki ba pet ba yo kata ka kelajing sitam no lada ka kelajing sitam ba kim bam chu kila sedang hiar ga jingkia kila sedang ban keren merway kila sedang yo iya kirngai dai hakta ka por ba le se ka ta ka jing snow si chongki kala pan kam long shu e ka ba ngi dai ban shu e marway ngi dai ban ngi ban ailat e ki kan nang jur dai e ka por ba ngi dai ban pli hato pidon kam jing yarap hato pidon kam e bangi dai ban le hato don kam ne em bangin ya kendo e counselors don kam ne em bangin ya bangin le chim dawai. Thank you, Dr. Abhinav, for that. There is another specific question to Bat Truman. Throughout this COVID-19 pandemic, people are being exposed to various heartbreaking and difficult scenarios, many a times resulting in situations causing a lot of grief, a lot of guilt, regret, and shame, such as the loss of a loved one or the guilt of not being able to take care of a loved one due to being separated from them in quarantine or isolation. What can be done to alleviate their distress?
Answering to the question on grief, first of all, I think we should understand that grief here, it is a reaction to a situation which is something which is very, very sad, something which is not really, something which is not really nice. So here, what I can say is that first of all, we should understand that life here, it comprises of both birth as well as death. So that is life. Everybody, we have to pass on these two stages, that is birth and at the same time death. So therefore, what we have to do is that in certain situation or in certain circumstances like that, when we have to deal with the loss of a family member, the first and foremost is that we need to accept first the situation. Because if we are not able to accept the situation, that means it becomes very, very difficult for an individual to move forward in their life. And it also, like Dr. Avinav was just saying, that it becomes very difficult for them to even cope up with certain situations in their life. So therefore, it is very, very important to accept first the situation and deal with it in a proper way. Because it is only by accepting the situation and deal with that particular situation in a proper way, then only you will be able to cope up with this certain situation. And also we should understand, I understand that sometimes for me it's very, very easy to say this, but for those family members who have met or who have encountered this kind of situation, I know it is very, very hard and it's very, very difficult for them. But then at the end of the day, yes, I understand there is pain, there is anger, there is frustration, there are so many emotions that comes along with it. But at the end of the day, the only way that you have to be able to cope up with certain situation is just by accepting the situation and go along with the flow in order to bring out the balance in life. And if a person, or if any of it you cannot, you find it very, very hard, or you find it very, very difficult to cope up with this situation, of course, as Dr. Meban said just now, there are available counselors, there are available psychologists who is more and ready, to give some kind of help or some kind of treatment towards such family members. So I think this is my answer to the question.
Thank you so much, Bat Truman. It is actually very evident to see that a lot of the things that take place, the things that we have instituted, our practices and a lot of our restrictions are in fact doing a lot of damage mentally to patients and to people living in the society in general. So maybe it is time to rethink current isolation and quarantine practices, so that the mental trauma that is made to people in general can be minimized. Because we are seeing that patients are being treated alone in the hospital. when the relatives have already been exposed to patients. So certain people are saying that if the exposure has already happened, why should the patient be alone in the hospital? There's no added risk. So all these things maybe we need to reconsider. Hakabaya day, but ki ba ngi la ya ling ba ngi snow ba nadong shadong kabala ja but ki jing ki bangi ngi yakendo ha kene ka pandemic kala long shisha kala long shisha yangi bahkan kta ya jingmot jing perkat jongi ha borok kilian te hatu ngi don kam man perkat shushu ya ke ba nang ni shkmat ban ong ban pet yang sa shisien ya ki kendon ki kita ki jing ya jinglong pikir ban ong ba bangin la ban le ya ke ba anom kta than ya ke jing perkat jong ki pat ba hi borok. The next question I would like to request Dr. Kongla to address. Our frontline workers, especially the medical staffs, have witnessed a great deal of suffering and death. What are the mental health issues that might result from the same? And what do you suggest that we do in order to prevent and overcome such problems? And on the kakasi, ki brio, ki basumar, ki badai, ki bahakamat basumar, ya COVID-19, ya jingpang COVID-19, ki haki hospitals, haki clinic, ki layo shisha, ya jing jang ki brio, ki la ya jing shitam, ki la ya jing yap. Te hatu kini kani ke jing syam jong ki kapenlong ne yaki bakin kamlong kin kamlong bakin kam don chance ki kam kila ban yo yaki jing pang bakta yaki jing mot jing perkat but hatu don ne ba kum ki ba sumar yaki nongpang ngila ban le nang bang ngiru ngila ban sumar yala de kam tam ka jing mot jing perkat. Dr. Kongla.
So, Dr. Meman, mostly in any disaster, it is always taken care by our frontliners, and which includes our healthcare workers. And the bonsin ngim jubo kani ka jingkali kumno ka perkhat perdan jungki kalong kumno namar bang issue perkhat ba okay they are taking care of us, they should be fine. Tamba bonsin ki dan katto katni they express overwhelming exhaustion, feelings of detachment from the job that they're doing. They feel a sense of ineffectiveness while performing the job. Kim la man concentrate laki tray, what dal laki tray ro kisngo don ke bak duna haki. So they feel this lack of accomplishment. They kani kadai ke anda kila like phai shayeng pat ki salong shapting yo ki spread you new infection shala ki khon ne ki family. Hadin kata ki don kato kat ni ki be express ba ki miot thia yo den ki shapting ke banja namar ba ki bun ki guidelines ba mi ka ban mi ki sngi ki bun ki rules ki ain ba mi te kene ke ko be ka ba long pan shapting ye ki now pen ka jing shapting the jingling balong halor no, it's the tip of the iceberg. But what we need to address is the real problem. The real problem mainly health workers experience is they suffer from a role conflict between their role as a professional and their role as a parent when they go back home. Hajing tray ho ki day ban pendep kat tu kat ni ki kendon ki kam ki jam jong ki tangba dakila let shaying pat kila long different individuals they can different roles baki play kalong penkul mari jing perkhat jong ki. There's a way main issue that happens most commonly that health workers are most vulnerable to is something called moral injury. Moral injury is something when a healthcare provider usually they are repeatedly expected in the course of providing care to make certain choices or judgment which is against their moral beliefs. This is especially most in doctors who have to make life-threatening decisions, doctors at the ICU or maybe surgeons. So, they suffer a lot from moral injury. And this causes a lot of guilt and shame which cannot be expressed. And this guilt and shame causes profound psychological distress. So these are the issues we need to address with our healthcare workers. The kaibang nila akong kinikipor is number one, initially seek informal support. Kamna ibada ngisngo kiniki aka bangin like directly shiki psychiatrist niki psychologist. First ngila ban share but ki para log para jor lane ki colleagues bangiat relang lane ki chaplains ki pastors ki badan hospitals shipang kiniki aka bangi sngo namar pa most of them they are not up to a level ban ong ba they are disorders mo. So, hadin bang yu bang these informal support is not helping them. Hakatu ko por ke nila ban refer ki professionals to get their help, especially when it's like Dr. Avinash has said, especially when it affects your daily functioning, and especially your appetite is involved, your sleep is disturbed, and you are not able to make decisions in your workplace. And another thing which we can incorporate is maybe in the workplace, we can have more of motivational and moral boosting programs. And these are the issues which we can incorporate in healthcare systems to prevent the mental health deterioration of our healthcare workers. Thank you.
Thank you. Thank you so much, Dr. Dida, regarding that. Very clear, very concise, very precise, uh, encouragement and guidelines for us healthcare workers who are dealing with this COVID pandemic. It is actually a very difficult time for us. Like you said, all the things that you said actually it brings back all the memories of of battles that we never won. Thank you so much for that. I hope if there are any healthcare workers watching the show, I hope that you have received a little bit of clarity regarding what should be done and during this difficult times. That we also need to take care of ourselves as much as the patients that we are treating. The next question is to Dr. Abhinav. One question says, "What would 1 minute? What is the reason for the distrust?" No, no, sorry. What is the reason why people don't trust the vaccine? Means what is the underlying thing as to why people do not trust the vaccine? Yeah, I think you got my point.
Yeah. So actually, I saw that question, Mevan. See, basically, people have a range of reactions to anything very new. Then telling them to stick it into your body, it's absolutely new for an illness they've just recently been introduced to. There will be reactions of fear. So I think, in fact, one of the questions asked anonymously was, what should we do as frontline workers when someone is not believing the vaccine? What do we do next? Generally, the guidelines for having a conversation like this, where someone or the person you're talking to is just completely blocking or opposing your point of view, is to ask them an unexpected question. So how I would deal with that situation is I'd ask them, all right, you're hesitant about the vaccine, you don't believe it, I get that. What will it take for you to believe it? What kind of evidence would you like? What kind of things would make you change your mind? Often people don't have answers to that question. Then you just let them think about it a bit. And that could be an opening where you could start then talking about the evidence behind the vaccine. If usually a frontal assault brings out lots of defensive reactions, people get quite aggressive, being defensive about that at that point.
Thank you, Dr. Abhinav, for that very different approach to things. Kadang ke jingkili ba ikli iba iong ba ide iba tray po health department ikwa jing pensyai kumno ba ngila pensyai kat ni ke ai shushu ke bangila ban le bangin la ban pensyai bangila ban ong mengilak ban kentu ya kibriu bakin ngej haka vaksin. Te kat kum ke jing ong jong Dr. Abhinav haba ngika sorkar bat ki doctors ki hospitals kila ong ba kadai ke ba baha ban simi vaksin ndrei kibriu kidang kwa syu ya ke jing kentu ke jing pen hun kalong ka ba satia ndrei ke bangila ban keli ya ba kalong hatu ke baki ki kwa bot ke baki don kam bakin snow shingan ya kanika vaksin mut ke syu ke baki dang kwa ban don kam ke baki kwa ban pensyai ke syu ke baki dang artatien haba ya dai vaksin but haba bom palang hi shem ki in shem ba kita ki jing long kim da don hi ka juba banong badai nak bangakwa bangan yo iya kata dai ka dai tang ka jing tieng na po but haba bon ajing tieng na po but ka jing bom snow wa ban ya ka vaksin we la jang
Sorry,
koi
Dr. Bevan.
ya ya
Uh,
ya oh ya
from my personal experience, like I took the vaccine on March. After taking the vaccine, then around May, yeah, I got infected with the virus, but I had very mild symptoms. So, from my personal experience, long requirement of that, after you take the vaccine, even if you get infected with the virus, you should not be scared because you will not develop serious symptoms. You'll have only mild symptoms, or you may not have symptoms. So that should be that message should be convincing the people that they should take the vaccine.
kublai Dr. Ngoyong kumbai ong mai ru ila shim yau tika ba ba ila yo ai kachim sistem da sistem jor setia to kata kadai ai ka ba ban penlong ki bre ban so bha shim ka vaksin dai ban ti dan dai shu aba ni khat jelew ya kani long ka ai ka bai ong Dr. Abhinav ka long ba what lada ki bre ki la tiplut ki kita ki kitip wala dala shim yung vaccine la yo pang injur shu kitip man da shim yung vaccine ban yap na ka jing sitam kaduna bha kitip ba ka jing sepiang dun piang ka kham duna la dala shim yung vaccine ndai halor ka jing tip kita ki bro fight bu kadang don hi ka jing artaten ban ngej ba ulong be ba tre kam shisha te kum bai ong ni Dr. Abhinav approach hi ka bala bani rap ulong ban kli hi na kito ki bahayeng asam jami wei ban kili ka ai ka ban penlong ya phi bapin hun ya ka jing batai sa ka ai phi dan kang man ban bapin mangin pensyai ban ong ba ka dei ba don kam te pun sien lada ngila kali kumta lada ki don ki jingar tatin lada ngila ban penbai te ka jing diang yang vaksin kan makam so the next question maybe two more questions I will take up I would like to direct this question again to Dr. Abhinav. Does excessive fear and panic pose any additional risk for a patient who is being treated for COVID-19 disease? Hato ke jing tieng ke bomlong shu atau ke jing huslai ka la ne ban penlong ya unong pang uba syak sumar ya COVID-19 ba kan kamjur penban ka jing shitap. Dr. Abhinav.
So I would say, Meban, that the most direct way that fear and anxiety is going to affect that person is that fear and anxiety is when people make irrational decisions. So when that fear and anxiety is about a healthcare condition, they are likely to make irrational decisions about their healthcare, like not getting it treated, which will complicate the whole illness. Anxiety itself is unlikely to physically kill you, but the ways it affects your life can. So if because of that you're not taking care of yourself at all, you're not stepping out of the house at all, the anxiety is so crippling that every time you go to the market and see people, you're having panic attacks. That all of those ways you've changed your life, that will increase the chances of lots of other problems. But I'd say the most direct way that anxiety will cause you problems in the COVID pandemic is you're more likely to start double guessing everything your doctors are telling you and not get treated because you're anxious.
Thank you, Dr. Abhinav. We are also seeing, a lot of patients who do not cooperate with treatment because of excessive fear. They would actually require some non-invasive ventilation, but because of excessive fear, they will just not tolerate it. They will not get themselves to accept the treatment. So what you're saying is very true. It does affect treatment in a larger proportion. Kumbuyong i Dr. Abhinav iong ba lada ka jingtiang ka jurpalat. Bunsian na ka jingtiang hi wat lada fiyo bumpang COVID flu manong ba hadu bakan shim ya ka jingim jong pi bunsian kamlong ka ig ba ngiyo i bor rei lada ka jingtiang lada ka jingkhuslai kalong siya ka bomla ongsyo jing pepat kalong siya ig ka penlong yang i ba ngin le ki ba lada ngimting nginom le satya lada ngipang ka misu ka po klem jing perkat in lech hospital ngin doktor ngikwa ya ka dawai masuk ka po anrei hapa ka jing ka jur pelat ka penlong yang i bakarai jongi ha ka boya dei bat kumno ngin le habang ipang kata ka penlong ka penlong ka ki mau jentut ki penlong ki ding pengkiang yang i banyo ka jingkot jingkia kumba ngaru ngayo iya ginong pang habang sumar yaki hapo gi hospital kito ki bakam jor ka jingteng bonsin kimla wansha ya jing sumar lada ai oxygen ki bengno lada ong bakin thia bakin ki than kimla banle satya ta nomor ka jingteng long ka ka ba jor te ka dei shisha ban ong ba haba ka jingteng kala jor palat kala ban kta yangi haba ngi pang ya ka ngiyo ai ka jing pang COVID-19 te one last question to Dr. Dida Khangla. We have gone through about a year and a half of this pandemic, and you have been seeing patients continuously from that time. Can you just share a few experiences from your practice, which you feel is, very peculiar to the COVID-19 times, and which are very different had the same condition been encountered years ago?
All right. So you see, from the beginning of the pandemic, we at Suncare, we anticipated that there will be a surge of new cases of mental health problems that would come to our OPDs or maybe get admitted. But surprisingly, just a handful of new cases were COVID related. Just a handful that were directly related to the COVID pandemic, and the distress was so extreme that they had to be admitted. It was a very insignificant number. Most of the cases were those that relapsed. They were old cases, cases of mental illness, old cases who relapsed because of the lockdown. So that was the one thing we had noticed at our center. And so what we had done is we went to certain districts to deliver the medications. And so by the second wave, we saw that the relapses of the mental illness somehow decreased because we were able to go and deliver the medications. And most distressing mental illness that arose out of the pandemic were actually just mild cases which could be handled just by counseling, the talk therapy. So that was something that we had noticed at our center over the last 2 years. Thank you.
Thank you so much, Dr. Dida Khongla, for that clarification. One more question from Mr. HML Natep. Dr. Meban ya kito ki badan anxiety disorder hatu ni virus ula ban penjur ya kejing stam. Te ban jubab ya kata ngathrai Dr. Abhinav Rila batai ba lada kejing ngosi kejing tieng kejur palat kajing wan jong ki brio gospel kajing tre jong ki brio ban sha sumar habaki yo COVID-19 kalong ek ba ngimla ban bangimla ban tip te ha kata ka rukom hi kajur kajing shitam COVID kalaban kamjur haki tapi dapat nakawai galyang ru lada kibrio kibudan lupai ke anxiety problem kibudan lupai ke jingtiang ka bamlang shu nadu mensuaru te lese lada kiyo ayune COVID ataru kan penlong yakiba kan long penlong yakiba wat lada kim shitam no COVID ru kata jingtiang kalaban kiyo shushu so kadai ke ba don kambangin yalaban balance lang. Now I would like to I would like to wrap up tonight's discussion. I would like to bring everyone online again, and I request each and every one of the panelists if they have a single take-home message for our viewers tonight, what would that be? We'll start with Dr. Dida, Dr. Abhinav, Dr. Maoyong, and Mr. Truman.
See, Dr. Meban, any disaster, any pandemic, there will always be an end to it somewhere down the line. So the trauma doesn't last long. There are also positive stories that we have missed. There are positive stories that came out of the pandemic. So my take-home message is focus on the positive stories, have hope, and inculcate and try to develop feelings of gratitude, hope, and empathy, because these are all positive emotions which can help us get through difficult times. So that is my take-home message. Thank you.
Thank you very much. Dr. Abhinav?
I would say I agree with actually everything Dr. Daida said. I would say if people are struggling with coping with the pandemic, look back at your own life and ask yourself, in other times that were difficult, at other times that were stressful, what helped? And try to include that into your schedule in a pandemic friendly way. I'd like to repeat that I feel personally that it's been sort of conclusively proven in this global pandemic and worldwide lockdown that human beings need routines in their life. So focusing on what is your pandemic routine, what is your new normal routine. That if that routine is not satisfying for you, you need to work on it. And the third thing I'd say is, well, we're surviving a once in a century event, hopefully. So everyone can be a little kinder on themselves. It's okay if you're finding it a bit tough to like deal with it. It's a pandemic. No one's dealt with this.
Thank you, Abhinav. Dr. Maoyong? We cannot hear you. Please unmute. Yeah. Dr. Maoyong, can you please unmute yourself? We are not able to hear you.
Yeah. Oh, sorry. Yeah. Before I give the take home message, I would like to add some point to what Ida shared about the cases in sun care. So in our case in Mimhans also we had a lot of relapse due to we lack of daily psychiatry. So lately a lot of patient came back because they lacked the follow-up checkup. And due to this pandemic and due to lockdown, one patient experienced loss in business, and this patient developed depression with psychotic feature. So yeah, that is what we experienced. And when it comes to my take-home message, is like I would like to tell the people: be aware that this pandemic do exist, so that you can take precaution like wear masks, wash hands, use sanitizer, and maintain social distancing. But do not think about this pandemic too much. Don't fear. Don't watch too much news about the pandemic, and don't let this fear get inserted into your mind. But if you cannot control the fear, then just follow the coping strategies. Thank you.
Thank you, Dr. Maoyong. Mr. Truman. That's really
Well, to end this program, I would like to end this take note, home message is just by these three things. Number one is that every individual, like I said from the very beginning, that first and foremost, they really need to take care first of their mental health, because mental health here has is very much associated with these three domains of our life, which is our thinking, our feelings, and our behavior. So if these three domains of our life is properly being taken care of, I'm sure we will be able to battle and we will be able to come out of this pandemic situation very, very easily. And then secondly is that I also feel that individual responsibility is very, very important at this point of time. I recently read a quote somewhere which says that being human is given, but keeping our humanity is a choice. So let's choose humanity, that is by adopting and by practicing this responsibility. Whether when I'm saying adopting this individual responsibility, either by getting themselves vaccinated or by getting the correct information in order to overcome the fear as the topic of this discussion today, and also by following the protocols as well as the restriction, because whatever we are going through at this point of time is definitely for our safety. So once we start adopting this individual responsibility, I'm sure we will be able to fight together and win this virus, win this pandemic together. And lastly, I would also like to end on a note that in case if any of the individual, they find it very, very hard or very, very difficult to cope up with the current situation that we are all in today, please remember that they can directly call to this toll line help number, which is 14410, where they can get any psychological treatment or any kind of treatment which is available for such individual. And apart from that, there is also a psychological support unit in every district of the state where anybody, they can seek their psychological support in case if they find it really, really hard and really, really difficult to combat with this COVID-19 situation. So these are the only three messages which I would like to share with everyone. Thank you.
Thank you so much. Viewers, just remember that there is hope at the end of the tunnel. Make a new normal. Make a new normal. Try to cope with your problems. Do not fear. And please take care of your mental health, which is very important. And please note that there are services like 14410 that will be that can assist you if you do experience such problems. Thank you, friends. Thank you so much for the time spent to enlighten our viewers from across the state. Your contribution towards overcoming fear of COVID-19 is very much appreciated. To end the session, I would like to also give my own take-home message. That is, if you fear, you have already suffered. Lada pitien, pila dep jenjar lupa. Te kublai shibon ya baro kiba laya don rengkat batngi ki parlop kiba ya pleo jingmut hangni hapo studio kiba la pelat yang ngapor chungki ban pensya ya ki pajba kumno bangin le haba ngidon kam ban sumar ya la kejong jingmut jing perkhat haba ya dai bat kani kejing ke bangi ya lengba ka klam COVID-19 kublai shibon. Good night, tiaso.
Ni ban ngam so shat na do nen ka si ngam thlai ba ngam sa shat tang ba ngam so pheri ai
chayo
na so telot na sngo so khriat na thlai ngadon kam le check up
kapan toy mele check up kapan toy sa jam hi kani kadai ke jing kelak sun beneng
ni ban jerho da kisngi bat ka khriat ngadon kam le check up pe ya ka to ka phone udan u helpline number ba ong pi kong asam ni
onam le bakla kam le mangamo ada ma phi ne manu na ka yeng yo phi kidon ka jing sitom kum ka jerho ke shet penhiar sumuthaj duna ke jingring men sem duna ke bor jing mat bat ke bor jing sama si sendan kedai man sat slung ilade bat kedai malik test no ilade no COVID-19 deng artli ki mas hayeng ru at ong ikba hayeng bakin le komju
ngadon bok bangalayo jingkot nai shim kabu tes ilade bat wat jing rap kerke lada don kam haba fidan kum kanu ke jingpang ken mau ke jing sumari ilade kadai kadawai.
Issued in public interest by National Health Mission, Government of Meghalaya.